Welcome to My Conversation, a presentation of KAIL-TV My Central Valley. So let's get My Conversation started.
Hello there, good morning. Welcome to another episode of My Conversation right here on KAIL-TV, My Central Valley. Austin Reed with you on this Wednesday, midweek already. I hope you're having a great morning so far. Thank you so much for waking up with us and starting your Wednesday with My Conversation, weekdays 10 to 10:30 right after Access Hollywood Live. Hey, before we get into the show today, I want to give you a quick reminder. KAIL-TV is proud to be giving away tickets to the Strictly Strange Tour. That's featuring Tech-9, Bone Thugs and Harmony, and other musical guests. So the show is happening this Wednesday tonight, April 12th at the Selland Arena. For more details about how to win those tickets for tonight's show, just go to our Facebook page, type in KAIL-TV My Central Valley. Hey, I also want to mention to our wonderful viewers, everybody that's watching today, that Tech-9 is actually going to be sitting down with pro boxer Saul Lomas in our KAIL studio later this week. So stay tuned for that interview. Let's get My Conversation started. Today's show now. So Dr. Patrick Golden has been named a participating clinical site for the second trial to assess chelation therapy, otherwise known as TACT-2. It's going to examine the use of intravenous chelation treatments in combination with oral vitamins in diabetic patients with a prior heart attack to determine if they reduce recurrent heart episodes, such as heart attacks, stroke, death, and others by removing toxins from the blood. My studio audience, please welcome in Dr. Patrick Golden this morning so we can talk a little bit more about this. Doctor, hello there.
Hello, and thank you.
Good to see you.
Thank you, and good morning.
Good morning. Welcome to the show.
Well, great. Well, thanks for the opportunity that you've given me to speak about this exciting federally funded clinical trial. I'd like to talk to you a little bit about the principles of chelation therapy. If we look historically, there's epidemiological data that shows that toxins such as heavy metals, especially including lead and cadmium, are associated with hardening of the arteries. As a preventive cardiologist, it's really great for me to be invited to participate in this exciting trial. Now, one might ask, how do we become toxic on some of these metals, such as cadmium and lead? Well, these type of metal toxins are ubiquitous. They're found in many parts of our environment. For instance, lead used to always be in the gasoline until we came up with unleaded gasoline. There was a time when I was a young man when lead was even in the paint. And there were famous cases of lead poisoning associated with children eating paint chips. Lead nowadays tends to come from the soil, and it leaches and gets into the groundwater, sometimes even into our drinking water, unfortunately. Cadmium is mostly associated with cigarette smoking. It's one of the toxins that people ingest when they smoke cigarettes. Also a good point that usually isn't well known to the public is these toxins can be in makeup, such as lipsticks. And if you want to look at my second slide, it shows a picture of some of those environmental exposures.
Yeah, you brought 5 pictures, and we're looking at the second one out of 5 right now. And that just kind of, like you said, I mean, lead, and you know, in today's times, lead isn't as big of a problem as it was maybe 30 years ago, right?
Well, it depends on who you speak with. There have been some local instances of lead toxicity related to the drinking water, even here in the Fresno area.
Okay. Well, what's the next slide that we can look at? Picture number 3. You brought that, right?
Right, and picture number 3 talks about some of the results that occurred during the first trial. So I think I need to take a moment and explain that to you and your audience. In 2002, a group of investigators throughout the United States embarked on the TACT-1 trial. And what we looked at is patients who had had previous heart attacks. And the theory was that if we gave them intravenous chelation therapy in order to remove the toxic metals, that they would have less chances of having cardiovascular events. And what ended up occurring is the trial was significantly positive on the side favoring these treatments. In fact, if we look at the statistics, people that received active chelation therapy had a 41% less chance, we call that a relative risk. They had a 41% relative risk reduction in all major adverse cardiac events. So these events include things such as having a heart attack, having a stroke, requiring an angioplasty, requiring bypass surgery, and specifically the patients that received active chelation had a 43% less chance of dying, which is amazing. We have a lot of powerful treatments in preventive cardiology, such as using beta blockers, statin drugs, all of the things that a person's cardiologist routinely uses, but this is the only treatment that can boast such numbers.
Now you're looking for patients to come on board with you and participate in the study.
Yes, that's my purpose for being here, is to educate your audience that we need some volunteers. I think it's important also for people to realize that this study is not funded by any pharmaceutical company. It's funded by the NIH. So I look at it like, take advantage of your tax dollars.
There you go. And help others.
And help others, for sure, because if the TACT-2 results are anywhere near to the results that we found in TACT-1, it's very likely that insurance companies will actually be willing to pay for these treatments.
Very good. We're going to take a quick break, and coming up after this, we are going to get the information on where you can check out the study. So you're watching My Conversation. Do stay with us.
This episode of My Conversation is sponsored by Royal Furniture, with locations in Fresno and Clovis. This episode of My Conversation is sponsored by Royal Furniture, with locations in Fresno and Clovis.
Hey, welcome back to My Conversation. Let's continue the conversation on this Wednesday morning. I'm Austin Reed with Dr. Patrick Golden, who is looking for some help from you. Doctor, thanks for coming on, and thanks for continuing the conversation. Tell everybody again what your purpose today is.
Well, thanks again, Austin, and good morning again. What we're trying to do is recruit some patients that would be interested in taking part in a government study that's funded by the NIH, which is National Institute of Health. Now, basically, to reiterate, toxic metals such as lead and cadmium are known to not be friendly to the cardiovascular system in the human body, and likely can promote the process of hardening of the arteries, or atherosclerosis. And we know that disodium EDTA, which is the drug that does the chelation, is able to remove those toxins from the human body.
One of the numbers that you gave out earlier, 41%?
It causes a 41% reduction in major adverse cardiac events, but in particular a 43% reduction in death.
Okay.
And this is a high-risk population. These are patients that have already had a heart attack.
Sure.
and also are diabetic. So the basic patient that we're looking for has to be 50 years old or more, has to have diabetes, must have a previous history of heart attack, and preferably have normal kidney function. In fact, they need to have normal kidney function.
And then they can be a part of this study.
Yes.
Most likely,
Yes.
most likely. They'll contact your office.
Yes.
Hey, you brought a couple more slides and full screen graphics that explains more about the study. Let's pull those up. Maybe the fifth one, I think, right? The last one, which is pretty interesting information.
Right. The last one reiterates those statistics that I mentioned to you, where there's the 41% relative risk reduction in all events, but in particular, the death rate declined by 43% relative risk.
Wow, wow. How long, and you were telling me that for the patients that do take part in this study with you and your clinical office, it would be over 5 years?
Well, the total duration of the study will last 5 years, but each patient who participates will be with us for approximately 9 months receiving the infusions. They'll also receive vitamins that will be delivered to their homes from Duke University, which is doing the statistics for the study. There will be laboratory studies done. All of the laboratories will be analyzed out of Atlanta, the Center for Disease Control. So everything is very rigidly controlled. There also is a small honorarium that is paid to the patient for participation in the trial.
Okay, very good, very good. So realistically, less than a year, but then in 5 years from now, that's when you and them will get the results.
Right, and the study has promised that they will allow the patients to know at the end of the trial whether they receive the active treatment or not. It's a double-blinded, placebo-controlled trial, so even I don't know who's getting what.
Wow. It's going to be amazing, you know, once you get towards the end and you see and you kind of hear about what you're going, you know, what these drugs can do.
Yes.
Have you always, is this your specialty?
Well, I practice general internal medicine and preventive cardiology. In my office, I have used chelation therapy for approximately 20 years.
Wow. Okay. So, and you've noticed, have you noticed a lot of good from it?
Yes. Now, we have primarily treated metal toxicity more so than specifically targeting heart disease. One of the reasons for that is there's no insurance coverage. That's one of the reasons why it's important that this trial be completed. And I think any of the patient participants can feel good about participation in the trial when they find out, should the results be as good as they were the first time, that even Medicare should start to pay for patients to have this treatment.
That would be huge.
Yes.
That really would. Okay, we've got about 30 seconds left. So our viewers today, they're watching at home, they're thinking, you know what, I'd like to be a part of this study. How do they get in touch with you?
Well, they can call my office at 432-0716, Dr. Patrick Golden, or feel free to check out the TACT2 website, which is tac2.org. That's tac2.org.
TACT2.org. And where is your office for everybody out there?
We're at the corner of Spruce and Sharon, about a block north of the St. Agnes Medical Center.
Right in the heart of Fresno. Perfect. My studio audience, give it up for the doctor in the house today, Patrick Golden. Dr. Golden, thank you so much.
Austin.
Good luck with the study.
Appreciate it.
You'll have to come on back and update us on the
You got
progress.
it.
All right.
Thank you.
Hey, you come on back too. You're watching My Conversation only on KAIL, My Central Valley.
This episode of My Conversation is sponsored by Royal Furniture, with locations in Fresno and Clovis.